bus. Our reporter John Maguire has been finding out.
As London's air ambulance arrives for duty, its flight crew, paramedics and doctors have no idea what the day has in store. On average, it's called to 5 emergencies a day. All will involve patients who are critically ill or injured.
Checklist, which I've got a mini iPad.
The service, run by a charity, attracts doctors from around the world because of the high level of emergency care that its staff provides. A Canadian, Dr. Mike Christian, was one of the first medics on the scene at the London Bridge terror attacks last year.
I do know one of the paramedics who was first on scene and literally the first person there, and he was profoundly impacted by this, but sought the appropriate help and recognized the signs and symptoms he was experiencing that benefited him significantly. He's been able to return to his career and continue on after going through that.
He served as a military doctor in Afghanistan, so understands the after effects of severe trauma, and also that medical staff are some way behind the military in their awareness of post-traumatic stress disorder.
In your day-to-day work, when it's something you do as part of your regular career, I think, unlike the military, people are less aware that this can have an impact. So programs that have been placed in the military are now coming into the emergency services and even into healthcare to help people be able to recognize the impact this can have on them and have a healthy career.
This film was made by Dr. Matthew Walton, based on an incident he attended while flying with an air ambulance. He believes more could and should be done, especially to help young staff cope.
One part of what we're trying to do is create a briefing package which can be given to people who are new to this type of work, to give them some very simple education as to what they might see, what are the normal reactions that people can have, and what they can do if they do require any further help or support, and who they can turn to when they need it.
Just this week, Prince William spoke about how he was affected by his time as an air ambulance pilot.
The relation between the job and the personal life was what really took me over the edge. And I started feeling things that I've never felt before, and I got very sad and very down.
These issues will be discussed at the World Extreme Medicine Conference in Edinburgh today. Delegates will consider what more needs to be done to help people in the emergency services to cope with such traumatic events, to help each other and themselves, so that they can carry on helping those in such critical need. John Maguire, BBC News.
It's 22 minutes past.